Good afternoon. My name is Samantha Dickerson, and I'll be presenting on my agency Coastal Horizons today through my internship project presentation. I'll be telling you a little bit more about my responsibilities as the psychiatric practice management intern at the WHAT Center, which is the Wilmington Health Access for Teens Center through Coastal Horizons. To start and tell you more about the agency, Coastal Horizons is set up as a private nonprofit organization, which means we don't accept individual funding. We mainly accept corporation funding and funding through federal and state government. This means that we accept funding through Medicaid mainly, specifically Trillium. We also accept funding from New Hanover County and the City of Wilmington and corporations and groups such as the Duke Endowment. As you can see on this slide, our mission statement is to provide a continuum of professional services and to promote healthier lives, stronger families, and safer communities. Goals that feed into that are family preservation, which means helping youth that have experienced trauma or mental health issues, substance abuse and mental health rehabilitation, and opening school-based health centers for high school students in the area that may not be able to access health centers. Our structure is that we have a CEO, Margaret Weller Stargell, and we have a board of trustees with 18 members on it. We serve a wide variety of clientele and patients as far as our services go. This mainly is because we have different services. We have the WHAT clinic, we have substance abuse, we have rape crisis, which means we have all kinds of demographics coming to different locations for Coastal Horizons. I specifically got to work with people from birth to early 20s because I work in the WHAT clinic, and I got to also see family units, which include all different types of family units, which I thought was really interesting and cool to be able to see through this internship. Specialists that primarily work at my agency are behavioral health specialists, like psychiatrists and therapists, but we also have nurse practitioners and physicians that work for Coastal Horizons as well. My specific internship responsibilities were completing a monthly productivity report, which means I look at data based off of health codes and how we are billing healthcare systems like Medicaid for different services we provide, how much time is being spent with patients versus how much time is being spent doing paperwork, and how that factors into our specific providers' salaries. I also got to work very recently with talking to patients specifically, helping people set up Zoom and transferring all of our patients over to a telehealth-based system, so phone calls, FaceTime, and Zoom. I've also got to go in through the back end and collect healthcare codes from different providers and see how different providers are billing people for the telehealth meetings that they're having and reporting that back to my supervisor. Two really cool things I got to do were shadow with providers and research policies for CARF accreditation, which was a week-long accreditation where a national board came in and looked at all of our policies and looked at the different sites that we have and made sure that we were up to date and up to code with all of our policies. My specific internship project, however, was working with telehealth and telemedicine. So looking at the future of telemedicine and telehealth, how it can be used in a mental health basis, especially for the WHAT clinic. We already have different providers that work with telehealth because they can't get to different sites, so it makes it more accessible to different clients and patients to be able to see their providers without having to drive a very long distance, which might not be the best thing for our patients to have to do. I also get to look at how COVID specifically has influenced how telemedicine and telehealth will be used in the future. We have more people now using telehealth, and I've been looking at whether or not this makes people more comfortable with their telehealth experience or whether they feel rushed into it. So, as I said on the previous slide, some domains I covered were societal functions of public health, rural versus urban communities working with telehealth, data collection, basic methods of data, and using tools such as Excel to do accounting data for the productivity report. I also get to analyze that data and see what it means for different providers if they have differing salaries and how they're being paid, which was very interesting to me. And I also got to use technical writing and electronic technology through Excel. Specifically for me, the most important learning that took place was about the mental health field. I didn't know a lot about the mental health field before I started my internship, so this has been a really eye-opening experience for me. I've been able to work with doctors and clinics before, hospitals, but never really got to see the mental health side of practice. I also got to talk to more patients about their mental health experience, which was really interesting to me as well. And I got to work on my customer service and being a better manager overall, which will be very helpful for me because I'm planning on going into policy and management for my master's program. And I also got to learn more about accounting. I had no basic concept of accounting before I came into my internship, and I didn't know how I would use it as a manager. I didn't even know that we needed accounting, but now I do, and I know how to use Excel, and my internship supervisor has been very helpful teaching me how to do the productivity reports. What I liked most about my internship was that I got to see the CARF accreditation, which happens every 3 years, depending on how you are accredited. And I thought it was so interesting. I'd never had any experience working with policy either, except for the policy and law class that Dr. Baynard teaches. And it really expounded upon all that information that I learned in her class, and I really loved it. And I got to experience more of the policy side of policy and management, which really made me want to further continue working in policy. I also liked calling patients the least, which means calling patients to help with Zoom support and switching them over to Zoom. I mainly didn't like it because I didn't have the skills, the professionalism skills that I needed, but I got to research this and I really got to work on my professionalism as far as talking to patients over the phone, which was really helpful, even though it was my least favorite experience. So my CARF accreditation is my most memorable experience as well, and I definitely learned a lot from both of these instances. To conclude, I really enjoyed my internship. I thought that working through Coastal Horizons was really helpful for me learning different things about professionalism, learning different things about accounting, getting to know more and networking more with providers in my area and managers in my area. And I would really like to further this in my master's degree as well. And I thought it was very helpful to let me learn about policy and management. This is my works cited page, and thank you so much for listening to my presentation.